Welcome back. One final point before we go tonight. Senator Elizabeth Warren says Obamacare is not enough. President Obama tried, she said, but now it's time for the next step. The next step is single-payer health care. My question is, do you want Elizabeth Warren in charge of your medical decisions? And where in the world has government-run health care actually worked, Senator Warren? Maybe you'd like to pattern your plan after Cuba, where Fidel Castro bragged about his single-payer health care system and then defected to Spain for medical care when he got sick, where patients have to bring their own light bulbs to the hospital, their own blankets, their own pillows, where the operating rooms are so disgusting they look like medieval torture chambers, where the toilets are overflowing with toxic waste and surgical instruments are rusted out. It's funny how so many Cuban people risk their lives to swim through shark-infested waters to escape such a healthcare paradise, isn't it? Maybe Senator Warren would like to pattern her plan after Venezuela's government-run healthcare, where new moms are kicked off the maternity ward because tear gas fills the hospital, where 1 out of every 3 people admitted to Venezuela's public hospitals died in 2015, where 85% of medications are out of supply, where a child with a scraped knee can't get antibiotics to prevent infection and ends up withering away in the hospital for months, saved only by the medication donated to him by another mother whose son didn't need the medication anymore because he'd already died. Maybe Senator Warren would like to pattern her plan after Canada, where Canadians cross the border into the U.S. to get away from big daddy government rationing care and denying them cancer treatment. Maybe Senator Warren would like to pattern her plan after the UK, where British people who smoke or British people who are fat are banned from getting hip or knee surgery because it's too much money for the government to spend for people whose lives are not worth living, according to the government. Where 1 out of every 4 British cancer patients is denied treatment with the latest life-saving drugs. Maybe Senator Warren would like to pattern her plan after France, where 90% of French citizens purchase supplementary insurance in addition to what the government gives them for free, because what the government gives them isn't enough. Maybe Senator Warren would like to pattern her plan after our own version of government-run healthcare right here in the United States, the Veterans Affairs, who can't even take care of the men and women who serve our nation, where military veterans wait on hold when they call suicide hotlines, where veterans die waiting for care, where employees can't be fired for abusing the system, where the bureaucrats who run the system purchase millions of dollars worth of expensive artwork for the waiting rooms to make the wait more pleasant, instead of hiring new doctors to make the waits obsolete. Senator Warren, government-run healthcare doesn't work. And we don't want you and your liberal buddies in government in charge of our health. And that's my final point tonight. You can reach me on Twitter at Liz_Wheeler. If you liked the show, please send me an email at oann.com/contact. In the meantime, catch us here tomorrow at 9 p.m. Eastern, and until then, have a good night.